Okay, hi everybody. So today we're going to start the traumatic brain, start and finish the traumatic brain injury lecture. You'll notice a lot of similarities between our stroke lecture, especially the rehab um, component, um, and then there will be some really distinct differences as well. So I uploaded a video. So if you haven't watched the video yet, I would recommend kind of pausing this little lecture video, going back and opening up this video on YouTube. This is a really kind of powerful video about this gentleman who suffered a traumatic brain injury, and you kind of see him through his course of rehab. Um, and I think it gives you a really good kind of visual handle on the course that these folks take from coma to surgery to, doing kind of inpatient all the way through really active outpatient physical therapy for the traumatic brain injury patient. It's really, I think, a good video. So I would recommend you going back and then coming back to me. So when we talk about traumatic brain injury, you'll often hear the phrase, TBI. So the definition for traumatic brain injury is an insult to the brain. It's considered traumatic if it's not degenerative, which means it's not going to get worse or progress. It's also not congenital, which means folks weren't born with this traumatic brain injury. So to actually fall under that traumatic brain injury category, it needs to be caused by an external force making contact or impact to the head. We see the current some of the current numbers on traumatic brain injuries. The incidence is about 3.5 million people in our country sustain traumatic brain injuries every year, and about 56,000 of those victims actually die from the injury. So that's a lot of people. This is a really catastrophic event. So we have a lot of victims in our country every year. It's also really costly for our healthcare system. The cost of rehab for a person with a traumatic brain injury is estimated. Our country pays about $9 to $10 billion a year to treat our patients with traumatic brain injury. That's a lot of money. A little bit more about the demographics of this population. The male to female ratio is 2 to 1, which means twice as many men suffer traumatic brain injuries than women. The most common age range for these victims is 15 to 24 years old. So it's a really young population, right? These folks are kind of at the beginning of their lives. They're students, they're young adults, kind of just getting started with maybe career, job choices. So some of the common causes of traumatic brain injury would be 40% of these folks sustain a fall, 14% are motor vehicle accidents, 15% are struck by an object, and 10% by assaults, and then the rest are kind of other. Some of the secondary impairments that we see with our traumatic brain injury patients are increased ICP, intracranial pressure. So again, we're talking about our adult patients, which means their skulls are rigid, right? They're fused. Those bones are, are fused together. So we have this brain that's sitting in a kind of a closed, rigid skull. So all of a sudden, if they sustain a head injury or a traumatic brain injury, you could have, blood, loose blood that can pool and collect between the brain tissue and the skull, causing pressure and additional impairment. So folks also, one of the other big secondary impairments is anoxia, or a lack of blood supply. Remember, the brain and all of its nervous tissue demands a lot of the brain's blood and oxygen. So when there's a lack of oxygen to that fragile brain tissue, folks will sustain injury. We also see a post-traumatic epilepsy or seizures which can also cause secondary impairments and challenges for these patients. We're going to pause it here.